Which of the following is an appropriate reason to delay antibiotic administration in a stable patient? A. A complete blood count has not been drawn today. B. The patient is nauseated. C. A stool sample must be obtained first. D. Blood cultures must be obtained first. T. A blood type and screen is not up to date. The answer is D. Blood cultures must be obtained first. Obtaining a set of blood cultures before treating a bacterial infection helps to individualize care and reduce antibiotic resistance. Using a narrow-spectrum antibiotic doesn't work against so many types of bacteria. By identifying specific bacteria in the blood, a narrow-spectrum antibiotic may be chosen. A physician may prescribe a broad-spectrum antibiotic initially and change treatment later based on the results of the blood cultures. A 65-year-old male client is being discharged from the hospital on warfarin therapy for chronic atrial fibrillation. The nurse is aware that the discharge teaching needs to include which of the following instructions? A. Use a blade when shaving, avoid electric razors. B. Increase intake of leafy green vegetables. C. Warfarin is a medication that does not require monitoring. D. When having dental procedures there is no need to discontinue warfarin. E. Alcohol should be limited to no more 1 to 2 servings on an occasional basis. The answer is E. Alcohol should be limited to no more 1 to 2 servings on an occasional basis. Warfarin is an anticoagulant. Alcohol can increase this effect, so it should be limited or avoided. Leafy greens contain vitamin K and can reverse the action of warfarin. Warfarin needs monthly monitoring to check client internal normalized ratio, INR. Dental and surgical procedures may require discontinuation temporarily to avoid excess bleeding. Electric razors are preferred. The nurse is teaching a patient who has just been prescribed antibiotics. The nurse knows that teaching has been effective when the patient states which of the following? A. My mother was previously prescribed the same antibiotic. I may take some of her leftover pills if my symptoms return. B. An antibiotic will help me get over my case of the flu. C. An antibiotic might help prevent me from getting sick in the future. D. I should use a backup method of birth control if I use oral contraceptives while taking antibiotics. E. I can stop taking the antibiotics when I feel better. The answer is D. I should use a backup method of birth control if I use oral contraceptives while taking antibiotics. Antibiotics may interfere with the function of oral contraceptives. A woman who is on oral contraceptives must use a backup method of birth control to prevent pregnancy. Antibiotics should only be taken as prescribed. They should be taken continuously until all pills are gone. It is dangerous to take leftover antibiotics. Antibiotics will not prevent illness and do not work against viruses such as influenza. Misuse of antibiotics may contribute to antibiotic resistance and the rise of antibiotic-resistant bacteria. A client with a history of chronic stable angina takes nitroglycerine when needed for an acute attack. Which of the following is not associated with the administration of nitroglycerine? A. The patient may experience orthostatic hypotension. B. The mechanism of action involves increase in cardiac contractility. C. To prevent degradation, nitroglycerine should be kept in a closed dark bottle. D. Nitroglycerine can be taken sublingually by tablet or metered spray. E. The medication relieves pain within 3 minutes and provides relief for up to 1 hour. The answer is B. The mechanism of action involves increase in cardiac contractility. Nitroglycerine is a short-acting nitrate. This class of medication works by relaxing arterial and venous smooth muscle, promoting vasodilation. This medication does not improve cardiac contractility. A nurse checks the lithium level of a 28-year-old patient that has been prescribed lithium citrate and sees the level is 1.5 milliequivalents per L, and verifies that the patient has not taken more than the prescribed medication. The nurse advises the client to A. Eat salty foods. B. Drink 4 glasses of water a day. C. Exercise more often. D. Eat more red meat. The answer is A. Eat salty foods. Low sodium diets when taking lithium mood stabilizing drugs can result in toxicity. The nurse should tell the patient to eat salty foods to increase sodium intake.